everyone, welcome or welcome back to the channel, that is AMS MBBS lectures. In today's session we're going to continue the same topic, that is HIV and AIDS, and this is going to be the fifth part, and wherein I'm going to describe another important topic, and that is the NACO strategies for HIV diagnosis, guys. Again, now what are these strategies? It's nothing but, see guys, under lab diagnosis I let you all know that we are going to perform screening tests, yes or no? Now, once we perform the screening test, and I already said in the previous video also that the results coming from the screening test should always be confirmed by a supplemental or a confirmatory test. Okay, we should always confirm the results of the screening test using some another test like supplemental test or a confirmatory test. But the problem is that these two tests, guys, both these tests, okay, are expensive, and also they are not available everywhere. Okay, so facilities of these supplementary or confirmatory tests are not available everywhere. Therefore, NACO came up with the strategy that we are going to confirm the screening test we are going to confirm the screening test results by performing another screening test, guys. This is the concept of NACO strategy for HIV diagnosis. Okay, and NACO also provided some guidelines, guys, that we have to look. Okay, so it states that depending upon the situation or the condition, guys, whenever we are performing the screening test, okay, so its result can be used as such. Okay, there is no need of confirming it, or in certain conditions, okay, first screening test हमने perform किया, then the result of the first screening test has to be confirmed by a second screening test. Okay, and in some situations, guys, we have to perform a third screening test also. Yani ki, in addition to the first screening test, we can perform one or two tests. Yani ki maximum we can, at max, okay, we can perform 3 screening tests, okay, to confirm the diagnosis. Okay, that's the first point. Second guideline states that the first screening test that we're going to perform should be highly sensitive, while the second and the third screening test that we're going to perform should have high specificity, guys. Okay, that is the second guideline. Next thing, now over here we are going to perform 3 different screening tests. Okay, we're going to perform 3 screening tests, and all the screening tests should be differing from each other. Okay, either in terms of the principle or the antigen that is used for performing the test should be different, guys. Okay, that is the third guideline. Now comes the fourth guideline, which states that suppose the result that you are getting after performing the screening test is equivocal or indeterminate, means the result is doubtful. Okay, we cannot make any conclusion from such results. In such cases, we have to make use of those supplemental or confirmatory tests to resolve the confusion in the result, guys. Okay, so these were the important guidelines provided by NACO. Okay, so those same thing has been written over here as well. So depending upon the situation or the condition ke basis pe, we can perform either a single screening test can be performed and the result of which can be used as such, or we can perform the first screening test, and in addition to the first screening test we can perform another 1 or 2 screening tests. Yani ki at max we can perform 3 screening tests can be performed maximally. Okay, next they are stating that is जो भी हम लोग first screening test perform कर रहे, it should be highly sensitive, whereas the second and the third screening test should be having higher specificity, guys. Okay, now all the screening tests that we're going to perform, guys, all those tests should be different, either in terms of their principle or okay, the antigen that is used in the test should be different. Okay, please note the same kit should not be used again. That is also one of the guidelines. And last points, whenever the result coming from the screening test se jo result aane wala hai, if the result is kind of equivocal or indeterminate, in such cases we can make use of these supplemental test or confirmatory test की help हम लोग को लेनी पड़ेगी. Okay, so I hope the guidelines are clear over here. Okay, now there are total 4 strategies, okay, that we have to remember. Now the 4 strategies are strategy 1, strategy 2A, 2B, and strategy number 3. So there are total 4 strategies that we have to understand over here. And also each and every strategy I'm going to describe it under 2 subheadings. That is, first I'm going to describe the purpose of the strategy, Then we're going to look upon the test that we're going to perform under that strategy, guys. Okay. Now this is something that I wanted to let you all know, guys, that is in the upcoming slide, whenever I will be describing the test under different strategies, I will be using S1, S2, S3. Okay, S1, S2, and S3 indicates the first, second, and the third screening test. Okay, I'm not going to write the full forms all the time, so I'm using these short forms like S1, S2, and S3. Okay, and if I'm going to use I anywhere, it simply means the result is indeterminate, guys. Okay, the result is indeterminate. Clear? Now let's have a look on each of the strategies individually. The first strategy is something, now purpose is nothing but it's going to define where we are going to use this strategy. Strategy 1, okay, is used okay, during the transfusion and transplantation safety ke liye we use this thing. That is, it means we are going to use it for screening the blood donors in the blood banks. Okay, so blood banks mein whenever we are receiving the blood, guys, any donor who is any donor who is donating the blood in the blood banks, that blood which is donated is always screened for multiple disorders. Yes or no? Because the blood that you're taking from the donor should be healthy. Yes or no? It should be free from the disease. And one of the disorder that it is tested for is HIV, guys. Okay. So how are we going to test this thing? So strategy 1 is for transfusion and transplantation safety. We are screening the blood donors in the blood banks. Okay, for HIV. And how are we going to screen, or how are we going to test it for HIV? Simply over here in strategy 1, we are going to perform only a single screening test, and the result of which is used as such for the interpretation, guys. Okay, so we are performing a single screening test. So एक screening test हमने perform किया. What do you expect? Okay, what would be the result? Simple. Either the result would be positive for HIV, or the result would be coming negative for the HIV. If the result is positive for HIV, guys, then we have to discard the blood that is collected. Okay, so we have to discard the blood sample. Whereas when it comes to negative results, means definitely we can keep the blood sample. Okay, we can keep the blood that is collected. Okay, so here we are just doing a single screening test, and the result is used as such. Okay, that is strategy 1. That was all about strategy 1, guys. Clear ho gaya? Let's move on ahead towards the next slide. That is the second strategy. Now strategy 2 is divided under 2A and 2B. Now let's have a look on strategy 2A, which is the second NACO strategy, guys. Okay, the main purpose of this strategy is for sentinel surveillance. And what is the use of sentinel surveillance? It is there to understand the prevalence of a particular infection in a particular region, guys. Okay, now in short, if I explain you what is sentinel surveillance, you can say it is nothing but in a particular area certain healthcare facilities are selected, guys. Okay, or you can say labs also are selected for this purpose, and they are declared as sentinel sites. Okay, now what is the job of these sentinel sites? They are used to monitor specific diseases in a population. Okay, sentinel surveillance is a topic that you're going to study in detail under the subject community medicine in your upcoming third year, guys. Okay, so right now just remember strategy 2A, the purpose of strategy 2A is nothing but sentinel surveillance. Okay, now for doing sentinel surveillance, okay, under strategy 2A, we are performing something called as unlinked anonymous testing, or UAT, guys. Okay, now what are we doing under this thing? We are simply screening the blood which was taken from the patients from, okay, for purposes other than the HIV detection. I mean to say, suppose we are collecting the blood of the patient for a CBC और LFT KFT जैसे टेस्ट के लिए हमने पेशेंट का ब्लड लिया था. Now out of that blood some amount is taken and it is sent for screening for HIV, guys, without the patient knowing that your blood is being tested for HIV. So can I say that the informed consent is not taken while performing this unlinked anonymous testing? के अंदर we are not taking the informed consent of the patient that your blood sample which was collected for some other test like CBC or LFT KFT, some amount of that blood is also sent or is screened for the presence of HIV, guys. Now why are we doing this thing? Is for sentinel surveillance. Now, is it ethical to take the patient's blood and test it for HIV without taking the consent? Right? It sounds unethical, right? But it is ethical because whenever we are sending such samples for HIV screening, those samples are permanently decoded. They are permanently decoded of personal identifiers. What do I mean by this thing? So those samples are sent unlabeled, means no details of the patient. Okay, neither the name of the patient nor any detail revealing the identity of the patient is mentioned along with the sample that is sent for the HIV testing, guys. Okay, so therefore, so matlab, even if the test result is coming positive for HIV, it is not possible to trace back the patient, guys. Therefore, it's okay not to take the consent, and this is done just for sentinel surveillance and to understand the prevalence of infection, guys. Okay. Now, once we have taken all these blood samples from the patient, guys, okay, we are testing it for HIV. Yes or no? We are testing it for HIV. So how are we going to test it for HIV? So we are going to follow the two test format. Okay, what are we going to follow? The two test format. Okay, so matlab simple hai. Let's start. We are going to perform the first screening test, S1, yani ki first screening test is what we are going to perform over here. Now, when we are performing the first screen test, what are the two possibilities? Either the result would be positive or the result would be coming as negative. If the result is coming negative, so we are going to report the the sample as negative, directly report the sample as negative. And if the result is coming positive, then the first screening test should be always confirmed by performing the second screening test. We have to perform a second screening test over here. Abhi second screening test when we are performing, again the same two outcomes, either the result would be positive or the result would be negative. Okay, now pay attention to what I'm saying over here. That is, the first result is positive, second result is positive. Okay, second test ka result bhi positive aaya hai, then we can report the patient as negative. Okay, report the patient as a positive, report the patient as positive. Okay, now I'm saying that the first test, okay, on doing the first test the result is positive, on doing the second and by confirming it using the second test you get a negative result over here. So in the strategy 2A we should report the patient as negative. So report the patient negative. Understood what are we doing in strategy 2A, guys? Okay, next strategy, that is your strategy number 2B. Now this strategy 2B, what's the purpose? We are using this strategy for the diagnosis of HIV or AIDS in the symptomatic patients. Okay, symptomatic patients ke liye we are performing strategy 2B. Now for this thing, so symptomatic patient hai, we took the sample and we are doing the first screening test. Okay, first screening test, वही same two outcomes, either the result would be positive or the result would be coming as negative. If the result of the first screening test is negative, we are going to report the patient as negative. Report the patient as negative. Okay, now if the result is coming positive, then it should be confirmed by performing the second screening test. Again the same thing, two outcomes, the result would be positive or the result would be negative over here, guys. Okay, so I'm saying that is the first screening test ka result is positive, second screening test ka result bhi positive aaya hai, we are going to report the patient. Okay, report the patient positive. Okay, now I'm saying that is first result positive है, second result जो है हम लोगों का second test result जो है screening test का is coming out negative, but we know that the patient तो symptomatic है. So how now the second test is coming negative, the second test result is coming negative, but the patient is symptomatic. So we have to confirm the negative result of the second screening test by performing the third screening test, guys. Okay, and by doing the third screening test we will be getting either a positive result or a negative result. Okay, now pay attention what I'm saying, that is first result is positive, second result negative, so we perform the third result. Okay, and the third screening test is coming out to be positive. So it's a combination of positive, negative, positive. What is the result, guys? What are you going to label the result as? Indeterminate. The result is indeterminate, it is doubtful. Okay, now I'm saying that is the result is positive, then S2 is negative and S3 is coming out to be negative. So positive, negative, negative, we will say that we are going to report it as a negative case. Okay, report the patient as negative over here. Done. Let's have a look on the last strategy, that is strategy number 3, and this strategy is used for the diagnosis of HIV in the asymptomatic patient, guys. Okay, asymptomatic patient ke diagnosis ke liye we are doing. Apart from that, it is also used for the antenatal screening and screening of the patient who are awaiting surgery. देखिए surgery से पहले if you are suspecting HIV, so you are going to do a strategy number 3 का test, and in strategy 3 we are going with a test format. Okay, 3 test format means we are going to do 3 tests is something that we have to do compulsorily in this thing. Okay, so let's have a look. पहला स्क्रीनिंग टेस्ट हमने परफॉर्म किया, रिजल्ट वुड बी आइदर इट वुड बी पॉजिटिव और इट वुड बी नेगेटिव. नेगेटिव आ रहा है, सो वी आर गोइंग टू रिपोर्ट द पेशेंट एज अ नेगेटिव केस. Okay, we are going to say the patient is negative for HIV. If the first test result is coming positive, we are going to perform a second screening test. हमको perform करना पड़ेगा. Again, the result would be positive or the result would be negative. If the result is positive, we have to do a third screening test to confirm the result of the second screening test by performing the third screening test. अब थर्ड स्क्रीनिंग टेस्ट में वही चीज होगी, दैट इज इट कैन बी पॉजिटिव और इट कैन बी अ नेगेटिव रिजल्ट. ओके, first result is coming positive, first result positive, second result positive, third result also positive. All the results are coming positive, all the screening tests okay are coming positive. We are going to report the patient as a positive case of HIV. Okay, report the patient as positive over here. Okay, second category is the first 2 tests are positive and the third test is coming out to be negative over here. So ऐसे case में we will say the result is indeterminate. Okay, we say that the result is indeterminate. Okay, we are getting an indeterminate result. Okay, now I'm saying that is first result जो था हम लोग का वो positive आया. On doing the second screening test you're getting it as negative. So you did the third screening test again over here to confirm it. Okay, on doing the third screening test वही same दो possibilities, either it can be positive result or it can be negative result. Now you tell me, first test is positive, second test is negative, third test is positive. Positive, negative, positive. The answer is the result that is indeterminate. It is equivocal, it is doubtful. We cannot make any conclusion from this conditions. And in these conditions of indeterminate results, we have to make use of supplemental or a confirmatory test is something that is needed. Okay, then we all are having the last combination in this strategy 3, that is the first result is positive, second result is negative, and the third result is also negative. Now depending upon the patient, okay, if the patient is okay belonging to a high risk category guys, then we are going to report the patient as indeterminate result बोल देंगे हम लोग इसको, ठीक है. And if the patient is belonging to a lower risk category, then we can say that we can report the patient as negative. Okay, then here we can report the patient as negative. So are we done with all these strategies guys? There are 4 strategies we all just covered right now. Okay, so let's quickly recap what are the NACO strategies for HIV diagnosis guys. Okay, so over here we all first had a look on the various guidelines provided by your NACO guys. There were 4 guidelines that we had a look on. Yes or no? How many tests you have to use? First screening test, okay, highly sensitive. Second and third should be highly specific. है ना? Then different principles or different antigens, same screening kits should never be used. Okay, so then when are we going to use the supplemental or confirmatory test? Okay, whenever you're getting an equivocal or indeterminate result is there. तो ये सारी चीजें हमने गाइडलाइंस में स्टडी करी. ओके, नेक्स्ट टॉपिक, वी ऑल हैड अ लुक ऑन दीज 4 strategies individually guys. In the first strategy, this okay is used for the transfusion and transplantation safety, and over here we are only using a single screening test is something that we are performing over here. In strategy 2 guys, in strategy 2A, it is done for sentinel surveillance. Please remember, strategy 2A is not for diagnostic purposes. Okay, it is not that is we are using it for diagnostic, it's only for sentinel surveillance. Okay, only for research purposes we are having strategy 2A for understanding the prevalence of the infection in a particular region. And over here it is we are going to study, we studied the UAT, that is unlinked anonymous testing के बारे में हमने बात करी थी. And over here we are going to use a 2 test format, okay, that we did. So 2 screening test is something that is required in strategy 2A. In strategy 2B guys, it is done for the symptomatic patients. It is done for symptomatic patients के लिए we are doing this test. And in this strategy we are using either 2 screening tests or we are doing a 3 screening test. Okay, so 2 or 3 screening tests are required in this particular strategy 2B guys. Okay, and the last strategy that we studied was for asymptomatic patients or for antenatal screening or for the patients awaiting surgery guys. We want to screen for HIV, we are doing strategy 3, and in strategy 3 we are requiring 3 screening tests. Okay, therefore we are using a 3 test format in this thing guys. Okay, so we are done with all the strategies provided by NACO guys. Okay, so we are done with the topic, that is NACO strategy for HIV diagnosis. In the next part I will be covering the treatment along with the post exposure prophylaxis guys. So That is it for this session, guys. Thank you so much for watching. If you found this content useful, then do like, share, and subscribe to the channel. If you have any questions or queries, do comment down. I'm there to answer it. See you all in the next one. Bye bye.